Hello guys, welcome to our channel. This is Luke's Academy. Today I'm going to explain the basic concepts of CT scan and MRI. CT stands for computed tomography and MRI stands for magnetic resonance imaging. These two devices are the most advanced medical equipment help us to diagnose different conditions or different medical conditions by taking an image of our internal body. So by this video, we are going to see the common differences between the two devices, their indication, and finally the side effect of each devices. This is a CT scan machine, and this is a cross-sectional image taken from at the level of abdomen. As you see here, there is a hyperdense structure which is oral contrast in the stomach, and here is another hyperdense structure which is the vertebral bone. And this is the subcutaneous fats, the black or the hypodense structures are subcutaneous fats, and here the air within the stomach, and this is the liver, the right lobe and the left lobe, and this the central relative hypertension structures are the vascular system within the liver, the hepatic vein, and the hepatic arteries. And this is an image of MRI. CT or computed tomography scans and MRI or magnetic resonance imaging are two powerful imaging techniques, each with its own technology indications, differences, and potential side effects. Now let's break down these aspects in detail. CT scans, how it works. A CT scan uses X-rays taken from multiple angles around the body. A computer then compiles these images into cross-sectional slices that reveal structures inside the body. CT imaging provides a rapid look inside, essentially offering three-dimensional view constructed from many two-dimensional images. A lot of two-dimensional images are taken, and the computer compiles these two-dimensional images into three-dimensional images, and the radiologist interprets these images as different for diagnosis of different medical conditions. Now let's see what are the common indications for CT scan. CT scans are especially useful in emergency settings. These they are indicated for trauma and emergency, quickly detecting internal bleeding, whether within the abdomen or within the brain, like interventricular hemorrhage or subarachnoid hemorrhage, whether it can be pleural hemorrhage or hematoma, and it can be abdominal hematoma and like uh, uh, blood within the pleural cavity or hemothorax, and conditions like fractures, organ damage following an injury. So, during emergency and trauma conditions, it is better to evaluate the patient by ordering CT scan. The other indication is cancer evaluation, assessing tumors and staging cancer, where both soft tissues and bone involvement need evaluation. Lung and abdominal conditions, evaluating issues like pulmonary embolism, appendicitis, or liver disease. Guiding interventions, serving as a guide during biopsies or other minimally invasive procedures. As you know, most biopsies are guided by ultrasound or guided by CT scan. So during this condition, we are going to use as a guiding for applying biopsies. What are the common side effects using CT scan? As you know, CT scan uses X-rays. So X-ray has its own radiation. CT scans use ionizing radiation, which, while generally low per scan, can accumulate with repeated exposures. We have said that CT scans work by taking multiple images by X-rays. So these accumulated exposures, radiation exposures results can result damage to our body, radiation damage. This is why their use in children or for frequent follow-ups is considered carefully. Contrast agents. Uh, Many CT scans employ iodine-based contrast material to improve image clarity. These contrast can sometimes trigger allergic reactions or affect kidney function, particularly in high-risk individuals like patients in CKD or chronic kidney disease or any renal impairment, patients with renal impairment. So during this condition, we have to be cautious while using uh, oral contrasts or any contrasts. Now let's see MRI or magnetic resonance imaging scanners. How it works. MRI utilizes a strong magnetic field and radio waves. You see here magnetic field and radio waves to align hydrogen atoms mostly from water in our body. All these atoms relax back to their normal state. They emit signals picked up by MRI sensors, which computer then compiles or translates into detailed images. Unlike CT, MRI does not involve any radiation exposure. Rather, it uses magnetic field and radio waves. Now let's see the common indications of using MRI. MRI is particularly adept in at imaging soft tissues and commonly indicated when neurological evaluation, musculoskeletal imaging, soft tissue abnormalities, and complex anatomic regions. In case of neurological evaluation, detailed assessment of brain, spinal cord, and nerves. Musculoskeletal imaging, evaluating joints, muscle, tendon, and ligaments injuries. Soft tissue abnormalities, detecting tumors, inflammation abnormalities in organs like heart, liver, reproductive organs. So by these conditions, it is better to use MRI scan. Complex anatomic regions where high contrast resolution is needed to differentiate between similar soft tissue structures. What are the common side effects using MRI? Magnetic field concerns. The strong magnetic field necessitates that patients remove all metal objects before entering the scanner. Patients with certain implants, some pacemakers, aneurysm clips, or cochlear implants may not be eligible for an MRI unless the device is confirmed to be MRI safe. So before we order MRI, we have to be sure that the patient has no any aneurysm clips or cochlear implants or pacemakers. Otherwise, the patient will end up with complications. The other is claustrophobia and noise. The confined space of the MRI chamber can trigger claustrophobia in some people, and the machine produces loud noises during imaging. Air protection is usually provided, but these factors can make the experience uncomfortable. The other side effect is contrast material. If gadolinium-based contrast agents are used to elevate image quality, there is a small risk of allergic reaction or in rare cases, issues like nephrogenic symptoms, systemic fibrosis in those with severe kidney problems. If you are going to use contrast agents like gadolinium-based contrast agents, we have to be cautious in patients with kidney impairments. Now let's see what is the key difference between CT scan and MRI. The first one is imaging technology. CT uses X-rays to capture cross-sectional images quickly, ideal for assessing bone injuries, internal bleeding, and lung pathology. While MRI uses magnetic fields and radio waves to provide high-resolution images of soft tissues best for neurological and musculoskeletal evaluations. The second point is speed and patient comfort. CT typically very fast, often completed in under a minute per scan, which is beneficial during emergencies. While MRI longer scan times, usually 20 to 15 minutes, requires the patient to remain still for an extended period, which can be challenging. The third difference is radiation exposure. Where there is a CT scan uses X-rays, which involves ionizing radiation, posing a patient risk with repeated exposures. And as you know, radiation exposure is the common risk factor for developing tumors. MRI, free atom free from ionizing radiation, making it a safer option for repeated imaging, particularly when soft tissue detail is crucial. The fourth one is clinical applications. CT often first choice of acute settings. Evaluation of lung and bone abnormalities or where speed is essential. Whereas MRI is the preferred modality when detailed visualization of soft tissues is necessary, such as brain tumors, spinal cord injuries, or joint disorders. In summary, CT scans are rapid, effective for visualizing bones, detecting internal bleeding, evaluating acute trauma, but they involve ionizing radiation, which can be a concern over multiple exposures. And MRI scans provide detailed images of soft tissues without radiation exposure, although they require longer scan times, come with potential issues related to metal implants and might trigger claustrophobia or discomfort. This is all about the main details of CT scan and MRI. We have seen uh, their technological methods, how it takes an image of our body, their main difference, indication differences, and their side effects. Uh, have a nice time, guys. Thank you.